Stephen Richley. I'm a British citizen, but I've been resident in Uganda for the last 15 years. Recently I was diagnosed with arthritis of the hip. This came about after I'm somebody who's been very active in sport, going to the gym on a regular basis, and I do a lot of walking. Walking became difficult and painful, and when I had my hip x-rayed in Uganda, they diagnosed arthritis of the hip. The only cure for this, I'm told, was a hip replacement. I sent off my x-rays for a second opinion to a Harley Street surgeon who the previous year had worked on my shoulder, and he confirmed that it was arthritis. And I followed this up with a trip to the UK where I got some quotations for a hip replacement. On returning to Uganda, I was advised by many people that the operation can be done in India at a much lower cost from people with a very good expertise in this area. So through the internet, I came across Dr.Venkatachalam of Chettinad Health City in India, and I contacted him by email explaining the problem, asking for quotations and for what my options were regarding what kind of hip replacement, whether I would need a total hip replacement or a Birmingham hip resurfacing. Dr. Venkatachalam returned my emails promptly and gave me what seemed to be very well-informed advice. As a businessman in Uganda, my time is very important, and it's very difficult for me to take a lot of time away from my business. So I asked for an appointment at only 2 weeks' notice, and I was given that appointment, and I've had an operation 8 days ago, which is for the Birmingham hip resurfacing. After only 8 days, I can say that I no longer have any pain unless I put my full weight directly on my right leg, where it was my right hip that was resurfaced. I can walk with one crutch comfortably for about 100 yards, and I see that my leg movements are progressing very, very well. So I'm very happy to recommend Dr. Venkatachalam. Previously, I had some bad experience with my shoulder. I have also arthritis in my right shoulder, and I went to South Africa to a shoulder specialist, and the shoulder specialist almost immediately wanted to do some surgery, which was a rotator cuff repair. But I went back to Uganda and had an MRI scan after consulting with an orthopedic surgeon for a second opinion. The orthopedic surgeon then said that a rotator cuff repair was not the correct process to have, and recommended I see a shoulder specialist in the UK. I went to the UK, I saw a shoulder specialist who told me that it was my biceps ligament that needed to be repaired. I underwent an operation. I spent a lot of money, and after the operation I found that my shoulder was no better than before. It was only later that I was diagnosed, after more x-rays, with arthritis of the shoulder. So I'd lost a lot of faith in the medical system in the UK and in South Africa. And when many of my friends were going to India, I was happy to take their advice and look for an expert in India. I can say that my experience at the hospital has been a very good experience. The procedures that they performed, they were very thorough in the pre-operational procedures. They ensured that there was absolute maximum hygiene was adhered to. The anaesthetist was very thorough with his pain control. After the operation, they monitored all different types of things like heart rate, blood pressure, hemoglobin of the blood every hour. There was a nurse that stayed by my bedside for 24 hours after the operation. All the different parameters were recorded in a book and monitored by a doctor on call who regularly came to see how my progress was. And since leaving hospital, I'm very happy with the progress. So I would say there are two very important things in a hip replacement. One is the expertise of the surgeon. Physiotherapy exercises that are advised. I'm now staying in a hotel and I have a physiotherapist coming every evening to give me exercises to do. I'm at a heritage site, ancient heritage site, down by the seaside in Chennai. I'm at Hotel Mahabs, an ancient heritage site by the sea in Chennai. This is now 8 days after the operation, and I'm going to demonstrate how I can walk very comfortably with one crutch. See, I'm not suffering from any pain, can walk quite easily. I can stand quite easily without the use of the crutch. I'm very well balanced. Okay.